Hi everyone, welcome to Lecture 5. Today we're going to be talking about cardiovascular health. And so the goals for today, after leaving today's lecture, I hope that you'll be able to list the major components of the cardiovascular system and describe how blood is pumped and circulated throughout the body. I hope that you'll be able to describe the controllable and uncontrollable risk factors associated with cardiovascular disease, to talk about the major forms of cardiovascular disease and how they develop, and also to understand the steps that you can take to lower your personal risk of developing cardiovascular disease. In this first section, we're really going to be focusing on that first objective, which is really trying to understand all of the body parts and processes involved in the cardiovascular systems and getting a true understanding of their functioning. And so a broad overview of the cardiovascular system is that it circulates blood through the body and consists of the heart and blood vessels. And so you can see in the photo here on the slide that the cardiovascular system is a wide network of blood vessels that are all connected to the heart that circulate throughout your entire body. And so when thinking about the heart, which is one of the primary components of the cardiovascular system, I'd like you to think about a house. So within a house, there are rooms, there are doors, there is electricity, and there is plumbing. And so the heart is very, very similar to that. And so we're going to go through how that makeup can help you to think about what consists within the heart. And so within the heart, there are 4 rooms. And so the scientific term for these are chambers. So there are 4 chambers in the heart. As you can see on your screen, there is a photo there, and you can see that there are 2 small chambers at the top, and these are called atria. And so there is a right atrium and a left atrium. There are also 2 larger chambers on the bottom. These are called ventricles. So there's a right ventricle and a left ventricle. Between each of these chambers, there are doors, and these are called valves. And so these valves open and close to allow blood to flow through the heart, or to flow through different parts of the heart, through the chambers at different points in time. This is when that electricity comes in. And so the heart has a built-in electrical system that's called a pacemaker. So it understands when the heart needs to pump blood and when blood needs to return to the heart. And finally, it has plumbing. And so the heart has these small pipes, and we call those coronary arteries. And that is what transports the blood throughout the body. And so when we're thinking about how everything works together to keep the heart functioning and to keep the cardiovascular system working, we have a few things that we need to think about. So first, the chambers and the valves work together as a pump. So the heart is a muscle, and it pumps blood to the lungs and to other parts of the body. So each time the heart contracts, like a muscle would, this would be interpreted kind of as a beat. This pumping action is felt in the large arteries of the body as a pulsing sensation. So that's what you would feel when you take your pulse. So each one of those beats, so the pulses, is your heart muscle actually contracting to pump blood to your lungs and to other parts of your body. This pacemaker, so that electricity in the heart, allows your heart to pump blood 24 hours a day, 7 days a week. So there is not a moment at any time during the day, at any point during your life, where your heart is actually not pumping blood to your body. So it is an essential part of your well-being and the overall functioning of the body. And so these pipes, the coronary arteries, supply oxygen-rich blood to your heart muscles. So keeping in mind what we just learned about the heart and its components, let's think about that again in terms of the sides of the heart. And so when we think about the right side of the heart, so the right atrium and the right ventricle, This part of the heart, or the side of the heart, is responsible for pulmonary circulation. And so what that means is that this side of the heart is responsible for circulating blood between the heart and the lungs. So essentially, it is responsible for helping you breathe. If we take a look at the left side of the heart, so that left atrium and that left ventricle, this side of the heart supports systemic circulation. And so what that means is that this side of the heart circulates or pumps blood between the heart and the rest of the body. So it is delivering oxygen-rich blood to other parts of the body to support its movement and its functioning. And so, as was mentioned previously, to supply oxygen-rich blood to the body, your heart has a pump, an electrical system, and a blood supply. And we're going to go through these in more depth within the next few slides. And so on this slide, we're really talking about how the heart operates with all of those elements of the heart that we previously discussed. And so the vena cava that you'll see there in the picture that is displayed is either of the two large veins through which blood is returned to the right atrium of the heart. So this is blood that has been previously pumped out to the body and it has distributed the oxygen, and now that blood is coming back through that vena cava to be returned to the right atrium of the heart. The atria, so that right atrium and that left atrium, those are the two upper chambers that we discussed. They're the upper chambers of the heart, so those two upper rooms, and this is where the blood collects before passing to the ventricles. Once the blood has passed through the atria, it's now moved into the ventricles, and so those are the two lower chambers or rooms of the heart. And so these two larger rooms, if you remember, are responsible for taking that blood and pumping them through the arteries to the lungs and other parts of the body. So this is taking the blood that is now oxygenated and returning it to the lungs and to the body to fuel them with that oxygen and essentially that energy. And then the aorta, again, as you can see on the screen, is the large artery that receives blood from the left ventricle and then distributes it out to the body. And so, as was mentioned on a previous slide, the heart has an electrical system, and so it basically has a built-in pacemaker. And what this does is that there are electrical signals that occur from one part of the heart to the other. And so this results in a contraction, which squeezes blood from one part to another in a specific sequence and then to the rest of the body. And so it starts in the right atrium, and this is called a sinoatrial node. And this is the pacemaker of the heart, so it makes sure that a signal is sent a certain number of times per minute to ensure that the right volume of blood is being squeezed from one part of it to another and then to the rest of the body. And so if we're thinking about what this looks like in clinical practice, you can see an electrocardiogram, so an ECG. And this is a test that is done to determine how that electrical signal is occurring throughout the body. And so on this photo here, you see a strip where a patient or an individual would have had a reading put on various parts of their body to gather this electrocardiogram, so this strip here that shows us how the electrical signals are happening from one part of the heart to another. And this then helps physicians or healthcare providers to understand if there's a problem with blood flowing from one part of the heart to another, and as well as if it's flowing out to the body. And so when there's an abnormal electrocardiogram, taking a look at it and taking a look at the lines here on the chart and seeing where there may be irregularities will help us to determine what is going on in an individual's body. And so on this slide here, you'll see some important terms to remember as it relates to the contraction. And so when we're talking about systole, that is when the heart is contracting. And so that would be a reading of the heart's contraction. When we're talking about diastole, this is the period of relaxation of the heart. And so this essentially helps us to get an understanding of blood pressure, which is the force exerted by bloods on the walls of the blood vessels. And so this helps us to get an understanding of how much blood pressure is being exerted by the heart. And so that's why sometimes you'll hear things like high blood pressure or low blood pressure, and that just means how well the heart is pumping through the different parts of the heart, but also to other parts of the body, and it helps us to understand which treatment options would be most relevant for community members or patients if they're in hospital. And so in these last couple of slides surrounding the description of the heart, I want to talk about blood supply. And so when we're talking about blood supply, we're really talking about the 4 main coronary arteries. And so they are listed here, and I'll go over them in depth, but you can see where each of them is located on the diagrams that are also listed on this slide. And so the right coronary artery, also known as RCA, is on the right side of the heart, and this supplies blood to the walls of the ventricle and the right atrium. And so if you just have to remember right side, right coronary artery, and this complies or is associated with the right atrium and the right ventricle. And then when we're taking a look at the left side of the heart, we're looking at the left coronary artery. But that left coronary artery is split into 2 different branches. And so the left anterior descending, also known as the LAD artery, supplies blood to the front of the heart, the walls of the ventricle, and the left atrium. And then the circumflex artery supplies blood to the back of the heart, the walls, and the ventricles of the left atrium. And so within this blood supply, we also have blood vessels. And blood vessels are classified by their size and their function. So veins carry blood to the heart, and they are very thin-walled. And so the veins carry the blood that has already been deoxygenated. So that oxygenated blood has gone away to the lungs, to the different parts of the body. And once it has given those parts of the body and the lungs all of the oxygen that it carries, it then goes into the vein system, and it carries that blood back to the heart. On the flip side, we have arteries, and our arteries, as we just saw in the last slide, actually carry blood away from the heart. And these arteries, these blood vessels, are very thick elastic walls which can expand and relax depending on the volume of blood that is actually within the artery. And that's when we start talking about things like blood pressure and systole and diastole. We then have some smaller blood vessels, and so I know on the last slide we talked about veins and arteries, which are the kind of larger blood vessels that supply the blood within the body. That being said, there are some smaller blood vessels, and I just want to note, just because the blood vessels are smaller does not mean that they are less important. And so these smaller blood vessels can also be known as capillaries. And these are very small, tiny blood vessels that serve to exchange oxygen and nutrients between the blood and the tissues. And so once the artery has finished its route, it then breaks into these capillaries, which then extend far beyond into the different parts of your body and within the lungs, in order to really ensure that blood is getting to all areas of the body as well as the lungs. And then we have coronary arteries that branch off the aorta and supply the heart muscle with oxygenated blood. And so the previous 13 slides really focused on the components of the heart and how the heart works. And so that was to achieve our first objective, which was to understand how the heart works and the functioning of all of the various parts of the heart. We are now in the next slides taking a look at objectives 2 and 3, which are really to understand heart disease and all of the diseases associated with the heart and try to understand some of those controllable and uncontrollable risk factors. And so heart disease is just defined or also known as ischemic heart disease or coronary heart disease. And it really refers to the buildup of plaque in the heart's arteries that could lead to a heart attack, heart failure, or death. And so if you think about how we just talked about the anatomy of the heart, you remember the arteries are actually what distribute blood to the rest of the body, right? So it's distributing the oxygenated blood to the lungs and to the other parts of the body to make sure that it is functioning and well oxygenated. But what happens is that plaque, so this buildup of kind of this white matter called plaque, will kind of build up in the arteries so much so that it constricts how much blood or volume of blood can flow to the body. And when there is too much plaque and too little blood flow that can kind of get to the rest of the body, that's what happens. That's when a heart attack could happen, heart failure, or it can lead to death. And so heart disease really just refers to what is really a group of conditions that affect the structure and function of the heart. And there can be very many root causes to this that we'll explore in some more depth in the coming slides. And so in the next few slides, we're going to be talking about heart diseases or heart conditions. And the first one that I want to talk to you about is called atherosclerosis. And basically, if you think about the past few slides when we were talking about the arteries, we talked about the arteries being thick, walled, but able to expand as the volume of blood expands. And so if we think about this disease, we really want to think about it as the thickening and the hardening of the arteries. So you can imagine how that becomes a problem, right, for a part of the heart that is supposed to be flexible and kind of expansive for that blood volume. And so these arteries then become very narrowed. And so when we were talking about that plaque earlier, we're talking about deposits of fat, cholesterol, and perhaps other substances that begin to accumulate over time within the artery. And as it gets thicker and thicker, that artery becomes more narrow. And so not a lot of blood is able to flow through appropriately. And so the endothelial cells, which are cells that line the arteries, actually become damaged, and one's body actually responds with inflammation. And so on this slide here, I really just want to break down that kind of plaque that we've been talking about. And so when we think about the arteries, so that lining where all of those cells are, this really attracts that LDL cholesterol. And what happens is that the platelets come in, leading to the buildup of plaque. And so plaque is just those deposits of fatty matter and other substances on the wall of the inner lining of the artery. And so plaque buildup over time in the coronary artery is called coronary heart disease. And so when we talk about lifestyle factors, because I know we were just talking about fat and cholesterol, you're probably thinking, oh, this is as a result of food and diet. And you are correct in some instances. But as we move through this lecture, we're also going to talk about how it's not just diet, although diet does play a significant role. There are also genetic factors that could lead to that plaque being built up more often in certain individuals. And so this slide right here is really just a visual depiction of the stages of plaque development. And so in that first picture right up at the top there, number 1, we can see that this is a healthy artery that allows blood to flow freely through the artery. And then in that second picture, we can see where that plaque buildup begins to happen when the endothelial cell lining of the arteries are damaged. And this can be done by smoking, high blood pressure, cholesterol, and other causes. And so you can see in 3, 4, 5, and 6, you can see that as that plaque starts to develop on that artery, that there is less opportunity for blood to be able to flow freely through that artery, and actually the plaque buildup is leading to that artery becoming stiff and non-flexible, right? And so when we have that narrow artery, like in number 5, it leaves us vulnerable to blockages by blood clots. And so we all have the risk of having small blood clots kind of freely moving through our arteries, but what happens is when there is enough plaque buildup and that artery is very narrow, that blood clot can actually get stuck and not pass through. And this is when we start to see the cutting off of the blood supply and oxygen to the lungs and other parts of the body, which kind of leads to those outcomes that we had previously discussed. And so as I mentioned previously, when we're talking about some of those contributors to heart disease, we know that the buildup of plaque is caused by an injury to the linking of the coronary artery. And so these injuries can be caused by high blood pressure, which is as a result of kind of that LDL cholesterol, so that bad cholesterol that we kind of know it as. It can be caused by diabetes, obesity, smoking, high blood pressure, as well as lack of physical inactivity, stress, and family history. And so when there is a blocked artery, so when there is a complete blockage of that artery and no blood is able to flow through, the heart muscle becomes damaged. And so some of the physical signs that a person will experience during a heart attack is that chest discomfort, so squeezing, pressure, burning, or heaviness. They may feel some discomfort in the neck, the jaw, the back, their arms or shoulders. They will be short of breath. They likely will have some sweating and some nausea, and they could be lightheaded. And so it's really important if an individual is experiencing any of these signs and symptoms that they get professional help as quickly as possible to try to reduce the amount of damage that is happening to the heart. And so in these instances, always calling 911 or being able to find a defibrillator if you're somewhere public is probably the best option for individuals who are having these signs and symptoms or experiencing a heart attack. And so angina will be one of the kind of first telltale signs that there is a blockage in your artery. And so this is when there is a blocked coronary artery, so not a full blockage, so not a heart attack, but the heart does not receive enough oxygen-rich blood when that artery is narrowed because of that partial blockage. And so there are a few different types of angina, and as you can see, we're looking at the electrocardiogram again up there in that image. And as I mentioned, this shows the rhythm or the electricity of the heart, so how the blood is being pumped from one chamber to the next and ultimately out to the lungs and the other parts of the body. And so when we're taking a look at this and it is abnormal for any variety of reasons, we're able to understand what that looks like. And so we can have something that is called a silent angina, and so this is called ischemia. And basically this is when not enough blood and oxygen is being supplied to areas of the body. But typically you don't feel any symptoms, but the body is unprepared for activities. So it's really not getting ready to do the things that you need it to do. And one of the contributing factors of this could be diabetes. We then have stable angina, which typically is something that we see during physical activity, stressful situations, or after a heavy meal. However, this type of angina is predictable. The pattern is consistent and it's actually quite short. And then the final type of angina that we can have is an unstable rhythm. And so this can happen at any time, basically when an individual is resting, sleeping, or any small amounts of physical effort are happening. We see that there is an abnormal rhythm of the heart, and so that rhythm becomes unstable, and it's not something that we would be expecting to see in those instances. And so it's not predictable, and it can occur for up to 30 minutes at a time, and that's when an individual should be contacting 911 or that emergency medical service to be seeking attention and help. Then the final kind of component here that I wanted to talk about is heart failure. And so heart failure can be caused by poor blood flow to the heart over a long period of time. So if you've had coronary artery disease over a long period of time, so perhaps you haven't had a full blockage or a heart attack, but you've been experiencing kind of that poor blood flow or that accumulation of plaque over a long period of time, this can lead to heart failure. And so it's basically when there's been damage to the heart muscle from a heart attack as well. And so this is kind of years of untreated blood pressure. It could include a faulty heart valve, any viral infections, or disease of the heart muscle. And so there are some signs and symptoms of heart failure. The first is shortness of breath, and so this would be chronic, kind of on an ongoing basis. Swollen ankles and legs. And so if you remember, we were talking about the kind of signs of early heart disease and that plaque buildup, we were talking about how the response is inflammation of the body, right? And so swollen ankles and legs would not be a surprising sign and symptom if you were suffering from chronic plaque buildup for that coronary artery disease. Sudden weight gain, which would be caused by a lot of that inflammation. Tiredness or loss of energy, and then a nighttime cough caused by fluid buildup in the lungs. And so you should call your doctor if you have increased shortness of breath, your weight has increased more than 2 pounds over 2 days or 5 pounds in 1 week, and so that would be kind of unexplainable weight gain. You have extreme swelling of the feet or legs, and if you have increased urination at night. So the previous slides where we were talking about heart disease, we were really focused on kind of the diseases that were related to the arteries and the buildup of plaque in the arteries or full blockages that also created kind of those arrhythmias. Now I want to shift our focus over to some of those valve disorders, and so you'll see 3 listed here on the screen. And so we have, if you remember, the valves are those doors of our heart, right? So they're the valves that let blood flow from one chamber of the heart to the other. And so when we're talking about stenosis or narrowing of the valve, this is a disease of the valve that prevents it from opening and closing, right? So blood is not able to get from one chamber of the heart to the other. When we're talking about prolapse, we're talking about a faulty valve. And so this is when a flap doesn't close smoothly or evenly, right? Which may cause some of that arrhythmia or some of that issue with the rhythm of the heart with that electricity. And then finally, we have regurgitation of the valve, which occurs when the valve doesn't close securely, right? And so it's not properly closed, which allows the blood to flow backwards and forwards into the heart. And so that's not appropriate because we don't want oxygenated blood to go backwards and mix with the unoxygenated blood. It just is not the way that the system, the cardiovascular system, is set up to work. And so when we're talking about arrhythmias, we can have a slow arrhythmia or a fast arrhythmia. And so when we're thinking about a slow arrhythmia, we're really thinking about a slow heartbeat. And this is referred to as bradycardia. And that's when the heart is actually beating less than 60 beats per minute. And this is usually as a result of a blockage. But there are also arrhythmias that have a fast heartbeat, and this is called tachycardia, which is usually greater than 100 beats per minute. And this is when we experience things like atrial flutters, atrial fibrillation, supraventricular tachycardia, ventricular tachycardia and ventricular fibrillation, which are also just more technical terms for what that fast arrhythmia is looking like and what might be the root cause of that. And so signs of a too slow or too fast heartbeat may include chest pains or discomfort, shortness of breath, weakness, dizziness, and palpitations. And so in the next few slides, we're really going to be focusing on those risk factors, so those contributing factors to cardiovascular disease. And if you recall our lecture on epidemiology, we talked about how everybody has a certain level of risk, but there are other variables in one's life that can contribute to an elevated or a decreased risk of a certain disease. And so when we think about risk factors for cardiovascular disease, they can be put into two categories. And so on your right side, we have the unmodifiable risk factors. And this just means that these are risk factors that a person is born with. It's something that they cannot change. And so these include age, sex, your genetics, so those characteristics that you inherit, and your ethnicity. But then on the left-hand side, we have some major risk factors that can be changed. So these are modifiable. So these are more lifestyle factors, something that's within an individual's control to be changed to reduce their risk of cardiovascular disease. And so tobacco use, so smoking, high blood pressure, which is something that can be caused by stress, anxiety, also poor diet. Similar with high cholesterol, which is also diet related. We have physical inactivity, obesity, which is also diet related, diabetes type 2, which is primarily diet related. And then we also have stress, which is contextual, as we took a look at last week during our two lectures. And so this slide here is really important because it helps us to take a look at those risk factors by racial or ethnic groups to try to understand the risks of cardiovascular disease in each of these groups. And so when we took a look at these three groups, so we have non-Hispanic Blacks, Hispanics and Latinos, and South Asians, we notice that their risks by modifiable factors are very different. And so for those non-Hispanic Blacks, they have a higher risk of stroke, a higher risk of heart failure, a higher risk of cardiovascular disease, and a higher risk of cardiovascular disease mortality, so actually dying from heart disease. When we take a look at Hispanics and Latinos, we see a higher risk of cardiovascular disease, increase in obesity, increase in type 2 diabetes, but when compared with the other two groups, they actually have a lower rate of cardiovascular disease mortality. So they're less likely than the other two groups to die of a heart-related disease or a heart attack. And then finally, when we take a look at that South Asian group, we see that they have a higher risk of cardiovascular risk factors, a higher risk of stroke mortality, so they're more likely to die from a stroke, and they're more likely to have coronary heart disease. And so this slide right here really just gives you an example of how much those risk factors, those modifiable risk factors, actually increase the age of the heart. And so if you look at the graph that is shown on this slide, you'll see that they give you an actual age of a heart. So we're talking about a 45-year-old male. And we're adding in all of these modifiable risk factors. So we're saying that the individual smoked, that they had high blood pressure, that they were diabetic, and that they had a healthy weight. And we're saying that with all of these risk factors included, that the age of the heart is actually 75 years old. So it's actually 30 years older than the individual is itself. And then the second example is a 50-year-old female. So we're talking about how this individual is a non-smoker, how they have high blood pressure, they're diabetic, and they are obese, so they have a very large BMI, and how that individual's heart is predicted to kind of be 85 years old, and so 35 years older than the individual actually is. And so we can see how these modifiable risk factors have a really big impact on an individual's heart health, and that's why it's so important. And public health efforts focus on, healthy eating, healthy diets, proper physical activity, reducing the risk of diabetes, reducing stress among individuals, ensuring that we are not smoking. And all of these initiatives are ideally targeting individuals to help them be healthier for diseases such as this one. And so there are a few ways that you can reduce your risk of cardiovascular disease. The first is being smoke-free, so not smoking. The second is staying physically active, eating a healthy diet and maintaining a healthy weight, and limiting your alcohol use. And so all of these topics are actually ones that we're going to cover in lectures throughout this semester. And so we'll see all of the other diseases or things that an individual can avoid if they just reduce their risks with these kind of high-risk behaviors. The next few slides just provide some tips and tricks when we're thinking about health behaviors or positive health behaviors for cardiovascular health. So the first one is eating better. So just thinking about integrating whole foods, fruits and vegetables, lean proteins, nuts, seeds, and healthy fats into one's diet. Being more active. So the recommendation is that adults get 150 minutes per week of moderate physical activity and 75 minutes per week of vigorous physical activity. And for kids, this is 60 minutes of activity every day. Individuals are encouraged to quit tobacco. And finally, start to think about a healthy sleep routine. So for adults, this is 7 to 9 hours each night of positive sleep. And kids should be getting around 10 to 16 hours if they're 5 years of age or younger. And then this time kind of varies from 9 to 12 between the ages of 6 and 12, and then 8 to 10 hours for individuals aged 13 to 18 years. And so a good tip or golden rule for the grocery store is that one should stick to the outer perimeters of the store. So not going into all of those middle aisles essentially. And that's because that's where most of the stores stock their fresh, unprocessed foods like fruits, vegetables, eggs, or lean protein. And the more fresh foods you have in your shopping cart and in your body, the more likely you are to have a healthy body, including a healthy heart. And so in particular, these individuals are urging us to pay attention to some characteristics that have critical impacts on our heart health, which is sodium, so salt, sugar, and saturated fats. So ultimately, if we are doing the things outlined on the previous slide, so getting enough physical activity and eating well, this will help us to manage our weight. And so it will help us to ultimately maintain a healthy weight. And seemingly these same behaviors will help us to control our cholesterol intake and manage our blood sugar. And so controlling that blood sugar and that cholesterol, which is helpful for diabetes, which is also helpful for kind of that heart health and ensuring that plaque buildup is not happening on those artery walls. And then the final one is really managing our blood pressure, and this comes down to contextual factors such as making sure that we have appropriate stress levels, that we manage our anxiety, and that ultimately we also account for some of those genetic factors as well that could be influencing this. And so while it's important to kind of outline the things that you are able to do in order to reduce your risk factors for cardiovascular disease when we're talking about those modifiable risk factors, it's really important to consider those social determinants of health as we do so. And so it's very easy to say things like make sure that you purchase healthy foods, make sure that you're exercising enough, make sure that your stress levels are manageable, but it's also important for us to take these social determinants into health because those things are not easy for the majority of people, right? healthy foods cost more than other non-healthy options. There's not always opportunity for a gym membership, which is kind of costly to individuals, or perhaps there's no means to get there and it's not safe to walk outside in your neighborhood. And so really just being conscious that yes, those are the things that will help to reduce cardiovascular disease. That being said, we need to take those social factors into account when we're designing interventions because that's not the reality for a lot of individuals, and we need to make this more equitable and easier for people to be able to do those behaviors in the environments in which they live in. So this kind of leads us into our final slide where I'd like us to rethink some of the interventions that we propose as public health providers, but really just thinking about some of those culturally adapted interventions. And so really just thinking about kind of the language that people speak, the foods that they eat in certain cultures, and really trying to create interventions around language and food that are meaningful to those communities, which in turn would help to increase physical activity, improve diets, and ultimately lifestyle management within those communities if it was culturally adapted and appropriate. Really talking about health literacy interventions, and so trying to help people better understand what some of these terms and things mean, kind of in a lay person language, is much easier to kind of improve some things like blood pressure. And then we have kind of mobile or digital technology interventions. And so these are things like telemedicine, where you can speak to a healthcare provider kind of on the phone or via video, some mobile phone apps or some text messaging. And this is really helpful in facilitating behavior change or providing reminders to individuals or population at large to kind of think about cardiovascular disease in a different way, especially as it relates to those psychological factors. And then finally, taking a look at some of those community-based partnerships. So how can we foster relationships in communities, perhaps barbers, faith leaders, and some of those healthcare providers, and how can we leverage those partnerships to reach some of our more difficult populations in order to change some of those cardiovascular disease risk factors in those communities that we know are more vulnerable. And so that concludes our lecture today on cardiovascular health. And so based on today's lecture, you should be able to identify the key parts of the heart and how the cardiovascular system works. You should be able to ultimately define and describe some of these heart issues or conditions, as well as those risk factors associated with those. And finally, you should be able to think about some of those preventable things or behaviors an individual can do, as well as some interventions to kind of rethink cardiovascular disease. And so I'm going to end here. But if there are any questions related to cardiovascular disease in this lecture, we will take it up on Thursday during our next in-person lecture. And so if you've listened all the way to the end, thank you for listening, and I hope you have a lovely few days, and I will see you on Thursday in person in class. Thanks, everyone. Bye-bye.